Most babies have little rashes on their body, and as a pediatrician, you know we love making rash decisions. The most common rash is called erythema toxicum neonatorum.
That was a mouthful.
It sounds way scarier in Latin, doesn't it? It's a little red rash that kind of moves around the body. It's here today, it's gone tomorrow. Sometimes it's on the arm or leg. They look kind of like hives, but what's different is they have a little white dot in the middle, and they come and go all over the place. Totally normal. They're usually gone by 2 weeks. They aren't zits. Don't mess with them. Another type of rash is newborn acne. Yeah, that's right. Babies will sometimes have acne on their cheeks. Leave it alone. It'll go away. Sometimes you'll see a red spot on the eyelids, or in a month or so, you'll see it show up on the back of the neck. This is called nevus flammeus. Also completely harmless, and these fade away over the course of a year or 2.
That is weird.
Some babies come out so fast that their faces are dark. It looks like a bruise. That fades away as well. Nothing to fear. And the dark spot that's over baby's butt is called a Mongolian spot. And it also will go away in about 4 years. And no, the doctor didn't spank the baby when they came out. It is not a bruise.
I blame the internet. I didn't spank it.
Some red spots look like large drops of red paint. They're raised, and they start growing over the first few months. These are things we call hemangiomas, and they're harmless as long as they're not covering important areas like the nose, neck, eyes, or ears, and they can usually just be monitored. They can grow for up to a year, and then they slowly shrink over the next 10 years. But if your baby has more than 3 or 4, point them out to the doctor. If the baby's head has a scratch on it or a scab, this may be from a baby monitor that was put onto the scalp before they were born. This is something to make sure the baby was okay, and it should heal up just fine. But just let the doctor know if it gets red or worse. Lastly, if there are blisters or vesicles on the baby's body, or if there's a spotty red rash that when you push on it, it doesn't disappear and then come back. These are a little bit more serious, and you need to let the doctor know. And if you see the skin around the belly button getting red and that red starts to spread, it's also a problem. The doctor needs input right away.
I didn't know that. Surprisingly.
So the 3 types of rashes that would be a problem are blisters, red spots when you push on them that don't go away, and a spreading red circle around the belly button. These kinds of things your doctor needs to know about right away.
Man's got a PhD.
And remember, if you see something unusual with your baby, snap a quick picture or take a video with your cell phone. It may be very helpful to your doctor.
In a world where disclaimers are boring, one man...
Excuse me, Mr. Movie Trailer Voice Guy, please just read the copy in front of you.
Oh, sorry. This video is intended to give you informative, educational information. It is not intended for you to self-treat or diagnose yourself or your family. Because we want you to make good medical decisions when it comes to you and your family's health. Please first talk to your doctor before trying or attempting any of the information that you have seen or heard in this video. Thank you.
If you enjoyed what you saw today, don't forget to like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.